Lyme disease is actually the most common tick-borne disease in the United States. It is a spirochete infection. The spirochete is Borrelia burgdorferi in the Northeast or Borrelia mayonnaise in the United States. Lyme is considered an infectious disease because it is caused by an organism, in this case, the spirochete Borrelia. Lyme disease prevalence in New Jersey is actually quite high. It's 40 cases per 100,000 people. So in 2019, which is the last year that they actually clocked in the total numbers, there were 2,400 cases of Lyme disease in New Jersey. Only Pennsylvania and New York exceeded that with higher numbers. Lyme disease is transmitted from the bite of a deer tick. There are stages of the tick. So there's the larval stage, the nymph stage, and the adult stage. And the nymph stage is the primary vector for transmission in the spring and summer. And then the adult stage can also transmit in the cooler months. The tick has to be infected, incidentally, to transmit the disease. There are different types, more like you would say different phases. So there's acute Lyme disease, which is the flu-like illness and looks and smells like the flu, fever, chills, body aches. There is Lyme arthritis, which can be one joint. Typically, if it's one joint, it's the knee. That's the biggie. Can be multiple joints that are involved. There's Lyme heart, Lyme carditis. There's neurologic Lyme disease. So the Bell's palsy is probably the one that people know most about, but you can also get meningitis, Lyme radiculoneuropathy, which can be either pinched nerve or peripheral neuropathy. And then you can get encephalitis, which is a more acute brain inflammation, or any more chronic symptoms, toxic metabolic encephalopathy, memory issues, psych issues.